Hello, Dr. Delahunty here, Salt Lake City, Utah, Canyon Rim Dental. Just wanted to chime in today to talk a little bit about dental cleanings and why they're so important. Now, when we go to the dentist every 6 months, we're getting our teeth cleaned, and maybe known or maybe unknown to those who get their teeth cleaned, we're doing an assessment of your tissues and of the gums and all of these different things as we're doing the cleaning. And so let's refer to this module and look at the differences between, say, a healthy side and perhaps a more unhealthy side or situation that needs a little bit more care, attention to detail. What we see on this side is high bone and pink tissues. This is a healthy setting right here around this tooth. On the other end, however, you're noticing lower bone and darker tissues. Is a little purple or reddish like tissue that is very, very active as far as bleeding is concerned. You barely touch the tissues and they bleed quite heavily. On this side, these are tissues that are perhaps more floss, more well cared for. The hygiene is perhaps a little bit better on this side. Now, what's the difference between the cleanings? When you go to the dentist, we determine whether you qualify for the average or the traditional cleaning or whether it needs to be deeper. Well, we take measurements around the tooth, and those measurements are done with what's called the periodontal probe. We're measuring millimeters, and anywhere from 0 to 3 is a normal measurement, which is what you would probe between the tooth and the gums. We're probing in a fashion almost like this. This would be about a 3 millimeter probe depth, versus over here on this side, we're getting into deeper probe depths, maybe 5, 6, 7, 8 millimeters. Now, anything above a 3 is not normal. 4 millimeter probe depth is more like gingivitis. 5 and a 6 and a 7 and 8 and so forth are where we've lost bone. Notice again the trend here, the bone is high and it goes low down over here. Now if we turn this around, see a little bit better the depiction of what it could look like or would look like in the mouth. Healthy tissues, and then kind of in the interim, or kind of in between here, and then really unhealthy. Now this is not bone. It looks like it's kind of some sort of bone, but it's actually calculus or buildup, deposits that the mouth will put here naturally on the tooth. This is why you go into the hygienist, so that we stay looking healthy here and not getting into this range here where this is somebody who hasn't been in for perhaps years to the dentist, and we've lost tissue attachment and bone, and you can see what that does. The tissues used to be real high and now they're real low. This is a tooth that would even become mobile and eventually fall out. So again, the difference between an average or a typical cleaning and a deep cleaning is all in the measurements and where the patient is health-wise. Now typically it's a hygiene thing. There are rare cases where it's genetically involved, but the neat thing about going to your dentist is you can get that determined and hopefully on a more regular basis. This person over here is going to be on a 3 to 4 month cleaning. So every 3 or 4 months they're going in to get their teeth cleaned. Whereas this individual over here is going to go in perhaps every 6 months or thereabouts to get their teeth cleaned. They just don't need as much attention to those tissues as this individual would right here. Well, hopefully that makes sense there. And again, the difference between a light or a traditional cleaning and a deeper cleaning, periodontal issues. Thanks.